Today's order paper.
Private members' business. Resuming debate on motion M106, standing in the name of Mr. Serry concerning seniors.
Resuming debate. Resuming debate, the honourable member for North Island, Powell River. Order.
Thank you, Mr. Speaker. I'm pleased to be speaking on the motion from the member for Nickel Belt. As the NDP seniors critic, I cannot emphasize enough how important it is to bring our seniors' voices and opinions here in the House of Commons. This motion calls for a study on the development of a national seniors strategy. The NDP has been calling for a national senior strategy for years. After years of inaction from both Liberal and Conservatives, it's flattering to see a Liberal motion now calling for it. After organizing 11 town hall meetings across my riding of North Island Powell River on seniors issues, the people I work for were very clear. They want action. The hundreds of participants had a whole range of grievances that require help. One woman in particular had a tremendous impact on me. She showed up just days after her mother's passing. With tears in her eyes, she spoke about how many gaps her mother fell through, how the care had not been as good as was required, and how exhausted she was during this incredibly painful process, where as a daughter she felt powerless. She said to me, "We need less talking, we need action now." I could not agree with her more, Mr. Speaker. This motion aims to create a study which may one day advise the government on a national senior strategies. Canadians can see through this Liberal approach and are rightfully worried about the intended impacts of this motion. If this passes, months later we will have a parliamentary report. My concern, and that of many of my constituents, and the concern of the daughter I mentioned earlier, it is time for reports to be done. It is time for action. With the Liberal government's recent approach in negotiating bilateral health agreements, I remain skeptical that we will see a cohesive national strategy in ageing anytime soon. This is serious. Too many seniors are falling through cracks and families are struggling profoundly. This needs to be addressed. Canada's population is aging rapidly. For the first time, there are more people aged 65 and older than there are children between the ages of 0 to 14 years. Right. By 2036, seniors are expected to make up 25% of the population. People aged 85 years and over make up the fastest growing group in Canada. This portion of the population grew by 127% between 1993 and 2013. The accelerating pace of aging in the population carries profound implications for everything from government budgets to pensions, health care, the labour market, and social services. In fact, Mr. Speaker, caring for aging parents costs Canadians an estimated $33 billion a year in out-of-pocket expenses and time taken from work. And that figure is expected to grow by more than 20% over the next decade, according to a report released last week by economists at CIBC. We can't afford to ignore this study. Action is required immediately. The Minister of Families, Children and Social Development thinks his government has a strong record. We've heard him praise himself and his government when it comes to seniors. He refuses to acknowledge the important role of caregivers and the economic impact of the country's changing demographic. The first step is admitting you have a problem. It seems the Liberals are still sleeping at the wheel. I have witnessed the financial hardship that caregiving has on people in my riding. Recently, at a town hall I held on the disability tax credit, a gentleman in his 80s came to speak with me about his challenges. This is an important story, Mr. Speaker, and I'm absolutely positive it is not a unique one across this country, because it outlines the emerging realities seniors are facing. He told me that he had a good pension, but now his wife has dementia and he is caring for her. He could not afford to put her in a care facility because there are no rooms that are subsidized, and the least expensive placement was $6,000 a month.
Wow.
He simply could not afford to pay that. How many people in Canada cannot afford that amount? He shared with me his deep fears. As the only caregiver, his health is now beginning to fail. I did not know what to say to him when he said to me, "What do we do if I get sick too?" The response, "We're just going to research it," would not be completely meaningless to someone who needs action now. The NDP has long held the position that to meet the coming challenge of an aging population, we need a thoughtful, strategic approach to seniors' care. This motion makes good strides in the right direction, but it falls short of implementing any action other than further study. It is disappointing that the member took the rare chance of bringing a motion to vote in order to pat this government on its back for past changes and without bringing any real action for seniors. The government cannot get away with doing something symbolic and refusing to take action. This motion is trying to toot the government's horn about the work that they've done in order to protect Liberals from the very real failures of delivering care to our seniors. Once again, they are trying to take the NDP's hard work and pass it off as their own without taking any concrete action. Although the motion is self-congratulatory, it fails to mention that the Liberals have not delivered on their clear platform promises of indexing OAS and GIS benefits to a new seniors price index. They have failed to take immediate investment in home care. They failed to make prescription drug costs affordable. They failed to make affordable housing a reality for seniors. Wait time for GIS and OAS is outrageous, and we know that the caregiver and disability tax credit are not filling the huge gaps that caregivers and their families are facing. I could go on. The Liberals' veil of self-congratulating is blinding them. The realities of too many seniors are ones of poverty and hard choices. It's time for a national senior strategy that has action at its core. Older Canadian women are twice as likely to live in poverty as men. 30% of senior Canadian women are living below the poverty line. A national strategy should focus not only on improving the lives of seniors, but removing the inequality that too many female seniors face. A new report by the CCPA BC office studying poverty and inequity among Canadian British Columbian seniors offers us a daunting portrait of the situation on the ground. Poverty in BC rose from a low of 2.2% in 1996 to 12.7% in 2014. 42% of BC seniors are currently experiencing core housing needs. I've heard of too many seniors struggling, making decisions between food and medication, or having to legally separate from their partners because placing one partner in long-term care means the other is left in poverty. These are just a few of the important examples. This motion needs to be amended to acknowledge the social determinants of health, prevention of illness, medical treatment and care, caregiver support, end-of-life care, pharmacare, affordable housing, and creating a seniors advocate. Most importantly, a senior strategy done comprehensively can reduce healthcare costs. Mr. Speaker, it is simply the right thing to do, both socially and financially. The Canadian Institute for Health Information reports that while seniors account for less than 15% of the population, they use approximately 45% of public health spending. The government cannot wait anymore. The research is in, and the time for action is now. The people of Canada cannot wait. The seniors of this country worked hard to build a society of prosperity, generosity, and sound institutions, and they continue to make valuable contributions. Now our country owes them a debt of responsibility. No one should have to grow old in poverty, insecurity, and isolation. Aging is indeed getting tougher. As Canadians age and their vulnerability increases, it is important that we continue advocating for a national seniors strategy. We need to make sure that our institutions and vital public services are strong and ready to meet the challenge of providing necessary services efficiently and effectively. I will be supporting this motion, but I do so with hope and also some hesitancy. I'm hoping that this will lead to an actual plan of action. No less is required of this increasing urgent issue. Canadians, seniors deserve the very best. Thank you, Mr. Speaker.
Honourable Member for South Shore, St. Margaret's.
Thank you, Mr. Speaker. I'm pleased to rise today to speak to motion M106, Developing a National Seniors Strategy Framework. Given that in my riding of South Shore St. Margaret's, seniors make up a large portion of the population. As a matter of fact, just over 20% of the residents of South Shore St. Margaret's are over the age of 65. Seniors across this country face many challenges, but I know that in particular, seniors in rural and remote areas can often be more isolated and alone than their urban peers. All across the country, countless organizations provide services to seniors that allow them to live with dignity and security, and ensuring that they are free of exploitation and abuse. To those organizations, I would like to say a heartfelt thank you. Unfortunately, Mr. Speaker, these programs often cannot reach every person in need, and too many seniors fall through the cracks and become vulnerable to crime and abuse due to reasons such as lack of affordable housing, poor health care, or low literacy, to name a few. This is why it's so important for the government to recognize that seniors require an ongoing, different level of attention from government than other parts of the population. We know that some seniors are more vulnerable than others and face extremely tight financial situations. That is why in Budget 2016, our government increased the Guaranteed Income Supplement top-up by up to $947 annually, helping to get more money to the most vulnerable seniors in our communities. We also canceled the increase in the eligibility age for old age security and guaranteed income supplements benefits from 65 to 67, a move that will put thousands of dollars in the pockets of Canadians as they become seniors. These budgetary decisions, Mr. Speaker, clearly demonstrate that we understand the central role that Canadian seniors have played in building this country. And because of this, they deserve safe and prosperous communities to live in and experience the best quality of life possible. One of the things I've heard about frequently during the election campaign and continue to hear since becoming a Member of Parliament is the need for better access to home care. The lives of many seniors could be greatly improved if they were only able to remain in their own homes longer, while still receiving the care and help they need, as opposed to moving to a long-term care facility or worse, staying in a hospital until a bed is available to them. It meant a lot to many of my constituents that in Budget 2017, we committed $6 billion to improve access to home care services. Greater access to home care will not only benefit our seniors by allowing them to stay in their homes, but will also help our healthcare systems in alleviating the issues of beds being tied up for patients on waiting lists. Seniors also benefit from other sorts of social investments in our communities, investments in things like affordable housing, cultural and recreational infrastructure, and public transportation, all benefit society as a whole, but often disproportionately benefit our seniors. Our government has committed $5 billion for a new national housing fund, $3.2 billion to support key priorities for affordable housing, $1.8 billion to cultural and recreational infrastructure, and $20.1 billion to support public transit needs in this country. All of these investments will have a direct, positive impact on the lives of seniors and those who support them. Another issue some of our seniors struggle with is their mental health, and we are seeing disorders such as hoarding becoming an increasing problem for our older populations. In my riding, we have a resource called the Mosaic Network, which is a community health network designed to improve the partnerships among those who provide care for seniors and older adults with complex behavioral issues such as hoarding. The network brings together various stakeholders to help increase awareness, increase knowledge, share best practices, and identify and share resources within our communities to work with those who exhibit hoarding behavior. It is important that the government recognize grassroots organizations like Mosaic and support them by making sure that healthcare stakeholders have the resources they need. Our government's commitment of $5 billion to support mental health initiatives has the potential to make a real difference in the work these organizations do and in the lives of our seniors. But quality of life for seniors is about more than just investments in health care, housing, and social programs. Mr. Speaker, it's often simply about making sure our seniors stay active and engaged in their communities and social circles to reduce the likelihood of isolation and accompanying mental health struggles. Community groups across my riding are finding interesting and innovative ways for seniors to stay active in their communities. Activities like storytelling, producing documentaries detailing their experiences, live theater productions, and simple crafting workshops are all ways to exercise their minds and engage our older Canadians. This year, I am particularly pleased that my riding of South Shore St. Margaret's will be hosting the provincial 55-plus games in September. Seniors from all across my riding will be coming to Lunenburg County to participate in activities from soccer to pickleball, cribbage to shuffleboard, swimming to track and field, all with the objective of keeping seniors active, engaged, and giving them the ability to share experiences with other seniors from around the province. I would like to recognize Events Lunenburg County for the hard work they've done in bringing this event to our area. Organizations and programs that work with and support seniors often rely on many hardworking volunteers, particularly in rural areas. Community members spend countless hours of their own time on things like preparing meals, providing transportation, or simply visiting and sharing stories with seniors. Working towards a national seniors strategy would allow us to identify where the shortfalls are and how we can fill the gap in helping our seniors and those who support them. They need to lead safer, happier, and more active lives. Seniors organizations also work in collaboration with many other community groups, healthcare organizations, and law enforcement. I know that in my riding, police forces work to increase personal safety for seniors through campaigns to raise awareness about fraud and scams, and by providing opportunities to learn firsthand about crime prevention. It's important that government recognize the diverse types of stakeholders at play when we're talking about the lives of seniors. Mr. Speaker, we are making great strides in addressing the issues that affect seniors, not only in my riding, but right across this country. However, as we have often heard our Prime Minister say, better is always possible. And I believe that we can do better to address the needs of older Canadians. As more and more Canadians move into old age, we have to do better. Mr. Speaker, before I finish, I would like to give a heartfelt thank you to all the community groups, police officers, healthcare professionals, home care workers, and friendly visitors in my riding who take time from their days to make the lives of our seniors just a little bit more enjoyable. I'm absolutely happy to support M106, as I believe it is important for this House to clearly demonstrate our commitment to seniors, to give them the comfort in knowing that their concerns are heard and that the government is taking action. I would encourage all of my colleagues to lend their support to this motion. I commend my colleague from Nickel Belt for bringing this motion forward, and I look forward to the rest of the debate. Thank you, Mr. Speaker.
Resuming debate, the honourable member for Langley Aldergrove.
Thank you, Mr. Speaker. It's a real honor to speak to M106, and I want to thank the member from Nickel Belt for introducing this this motion. Mr. Speaker, I'm also going to be introducing a motion 1 minute before I'm done, so I'd appreciate you letting me know when I've reached that 1 minute. Mr. Speaker, my career age began, met my wife at university, and we used to go to different senior complexes, and I'd play the guitar, and we'd sing together and provide music and a bit of entertainment. It wasn't great music, Mr. Speaker, but it was the love of our life to actually honor the senior members of our community and to thank them and to encourage them and interact with them, dialogue with them. And then through the years, as we started having children, we would, on Sunday after going to church, we would go visit the local rest home. We had actually asked the staff, the nurses, is there somebody here that's lonely that isn't getting visitors, somebody that we could visit? And so we raised our children by example, saying it's important to visit and honor and respect and give dignity to the senior members of our community. So we did that, and we have continued to do that. While I've been busy here in Ottawa, my wife adopted another lady for the last 10 years, Frida, and she got to visit her, and she just passed away, and now we're looking for a new grandma that we can adopt and visit. It's an important part of Canadian culture to honor the senior members. And it's a good indication of the heart and the quality of the country that we live in, to honor those. Mr. Speaker, I wish I could support M106 and recommend that others do, but unfortunately M106 has some mischievous political parts of it. When the previous government appointed a minister for seniors, and that's one of the major flaws, it's missing a call for the government to appoint a minister for seniors. Now, it was a year and a half ago this Parliament began. 2 years ago, the election process began, and the political parties met with Canadians, and we, the Conservative Party, clearly made it and showed by example from the previous parliaments the importance of taking care of seniors and preparing for an aging population. Mr. Speaker, right now, 1 in 6 Canadian is a senior. In 5.5 years, just like that, it'll be 1 in 5. In 12 years, it'll be 1 in 4. This major shift in Canada of an aging population, we have to prepare for it, and that's what the previous government was doing. Unfortunately, this government does not have a minister for seniors. And stakeholders across this country, senior stakeholders, have raised that with this government, saying, please, appoint a minister for seniors. Why have you not? Also begin a national senior strategy. Now, I was honored to be asked by our interim leader, would I be the critic for seniors? And I was honored to do that because I love seniors. And fact is, I am a senior. And realizing some of the challenges as our body ages and the disabilities and challenges that are associated with that. We need to provide for our seniors, work with our seniors, and provide the care and dignity that they need. So I was shocked that the government has refused for the last year and a half to appoint a minister for seniors and not begin a study on a national senior strategy. And that was what we've asked in question period, and we partnered with the NDP critic, asking the same thing. We have a national seniors caucus meeting, and we bring in different guest speakers, and what do we hear time and time again? Please appoint a minister for seniors and start work on a national senior strategy. Time is clicking. Canadian seniors are aging, and the Liberal government is asleep. Now, we have M106, and thankfully, they've asked for a study of a national senior strategy. Fortunately, I'm also on HUMA committee where this would be studied. So I actually, at committee for the last year and a half, have asked that the committee start on a national senior strategy. The Liberal government has waited for a year and a half, and that's a year and a half lost to preparing for this aging population. And in February, when we saw 106, I said, let's pre-study this. Let's begin the study now on a national senior strategy, and so that we are ready and we can get to work on this. And they said, no, we do not want to begin this. We want to wait until 106. So again, it's politically motivated. Well, Mr. Speaker, how is it politically motivated? Well, the first point of 106 acknowledges that we have an aging population. Well, we can support that. All the senior stakeholders support that. That's what the government has been told for the last year and a half. That's what Canadians have known. Stats Canada has told us for the last decade. You need to get ready for the aging population. It highlights that and acknowledges that. We can support that. Number B, that the government is hardworking, improving the lives for Canadian seniors by restoring OAS and GIS. Well, Mr. Speaker, it's really, it just highlights that this is a political document and the interference of the Prime Minister's office saying, we want you to put that in the bill. Now, the motion I'm going to be introducing in a moment is going to suggest that we take that out and keep it nonpartisan, political, and focus on taking care of our Canadian seniors. I hope the sponsor of the bill will accept that. And second, that we start the committee, HUMA starts on a national senior strategy and get to work on it. But there's no timelines, and we need to have clear timelines so that this is finished and we actually put this into work so we're ready for this aging population instead of a study that sits collecting dust on the top of the shelves. But point D is to broaden the mandate of the National Seniors Council to allow it to undertake reviews and analysis on its own initiative. The National Seniors Council was created in 2007 by the previous Conservative government to represent the needs of Canadian seniors. The Minister of Seniors was to identify, and Prime Minister's office was to identify needs of study and focus to get ready for the aging population. The government has instructed the sponsor of M106 that this body can create its own mandate, create its own analysis, and do its own thing, and it becomes meaningless. And that on its own is a reason why M106 can be supported, and hopefully the sponsor would agree to amend that by removing that. Mr. Speaker, the vast majority of Canadians that I've talked to on this, we all agree. Canadian seniors agree that yes, we need to appoint a minister for seniors. Yes, we need to start on a national senior strategy, and hopefully the government will accept that. We heard from the previous speaker all the things that they wish the government would do, but it really didn't acknowledge and address the issues of 106. 106 has some flaws and needs to be repaired. We hope and support the study of a national senior strategy, but let's remove those political, mischievous parts of the bill. Also, I'm concerned, it was last Friday, Mr. Speaker, that the Parliamentary Secretary for the Minister of Health was asked, how is the government going to take care of seniors? And the answer from the Parliamentary Secretary for Health was, well, they now have assisted suicide to help take care of this massive growing senior population. We were shocked to hear that. That should not be part of the plan. The plan is to protect seniors, give them dignity, and provide the services that they need. So, Mr. Speaker, I've highlighted the political parts of it, and so what I'd like to move, and hopefully the sponsor of the bill will accept this constructive suggestion, and I have talked to him ahead of time, so hopefully he'll accept this. It's made in good faith. So I move, seconded by the member for North Okanagan, Sue Schwab, and I want to thank him, that the motion be amended, M106 be amended by replacing all the words in Clause B with appoint a minister for seniors, and by deleting Clause D. Thank you, Mr. Speaker.
It is my duty to inform honourable members that pursuant to Standing Order 93.3, no amendment may be proposed to a private member's motion or to the motion for a second reading of a private member's bill unless the sponsor of the item indicates his or her consent. Therefore, I ask the honourable member for Nickel Belt if he consents to this amendment being moved.
Thank you, Mr.
Nickel-Belt,
Speaker. No, I don't.
There is no consent. Therefore, pursuant to Standing Order 93.3, the amendment cannot be moved at this time. Resuming debate, l'honorable député de Saint-Hyacinthe.
Honourable member for Saint-Hyacinthe-Bagotte. Mr. Speaker, I'm pleased to rise in this House today to discuss our seniors. They represent an increasing proportion of our population, and they are the ones who worked hard to build our economy and acquire the social benefits we have today. Our current social system was designed at a time where seniors only represented a small part of the population, and this is no longer effective in response to current problems. In 2035, 25% of our fellow citizens will be part of the golden agers. Today is when we have to work to prepare the future. In my riding of Saint-Hyacinthe-Bagotte, many are the organizations that are already mobilizing on a daily basis to improve the living conditions of our seniors. I'm referring to many Fédérations de l'Âge d'Or du Québec that allow our fellow citizens to continue to have social relationships and that fight against isolation. There are 17,000 seniors that are part of this network. In my riding, the volunteers in the Centre de Bénévolat de Saint-Hyacinthe-et-Acton also do tremendous work through Meals on Wheels, for instance, by distributing meals to those who are unable to cook or to travel easily. Seniors are also an incredible resource for our society. They are among those who are most involved in organizations and nonprofit associations. Their dedication inspires respect, and many of these organizations would have trouble operating without the volunteer efforts of our older citizens. I don't know what will happen after this generation passes on. It is our responsibility as members of Parliament to help and promote these kinds of commitments that are so precious for our communities. I worked in the community sector for years, and I know to what extent our elders are important to reinforce social links between citizens. According to the Quebec Institut de la Statistique, volunteers over 65 dedicate 190 hours a week to volunteering. Programs do exist to help our volunteers get involved in our communities. That is the case of the New Horizons for Seniors programs that allows us to get funding to promote volunteering among seniors and encourage them to take part in the lives of their communities, increase awareness of elder abuse, and support social inclusion and participation, as well as provide help for community programs. Requests for grants are open till June 23rd, and I urge all municipalities and organizations in my riding to file an application in order to be able to continue with their commitments. However, most of our seniors live in difficult situations today. As a member of Parliament, it's also our duty to do our best for seniors who are facing many different types of difficulties.
And this is why I organized an information session in March concerning tax forms to help our seniors. Over 200 people met in Saint-Hyacinthe, and the numbers went up last year. That's proof that there's a need for greater information for all Canadians. Many Canadians don't know that there are tax credits that they could benefit from because they don't have the information. And in order to provide that information, I put together a guide for seniors to ensure that they have access to all the services available to them. This is going to be distributed to all senior centres across my riding of Saint-Hyacinthe-Bagotte. It's a pleasure for me to help my seniors, and I'd like to remind you, Mr. Speaker, that this is a job that should be done by the government. So what happens to those who live in ridings where MPs don't offer that service? How many seniors are facing greater difficulty than they should be because they're not aware of these tax credits? Not everyone can pay an accountant to do their taxes for them. And once again, it's those who are the most vulnerable who are the first victims. However, this government's policy gaps for seniors don't stop there. Up to 90% of our seniors say that they suffer from one or more chronic illnesses. For a very long time, the NDP have been calling for a national pharmacare program which would allow the government, the federal government, to save billions of dollars a year and which would make medication more accessible to our most vulnerable populations. And what about the GIS? How many people can benefit from the GIS every year? Because sign-up isn't automatic? This is a measure that we could take simply, and it's a measure we should take right now. This government has also eliminated, and it did this when it put its first cabinet together, the portfolio for seniors. The responsibility for creating policy for seniors is now shared by a number of ministers, something which doesn't help and won't help us put in place the national strategy that we dearly need. However, the solutions are there, Mr. Speaker. The NDP moved a motion last October concerning the creation of a national seniors strategy. And I would like to note the incredible work done by my colleague from London, Fanshawe, who has worked with stakeholders to create a national strategy focused on healthcare, affordable housing, income security, and quality of life, as well as to promote the creation of a position for a seniors ombudsman who would ensure that the work is done to help our seniors. We are losing time and money by waiting once again for this government to act. My colleague's motion, my colleague from across the way, calls for the creation of a national senior strategy. However, I'm afraid that the government once again is simply going to undertake a public relations exercise, and they're not going to take this motion seriously to create a true policy that would make concrete changes in the daily lives of our seniors. Now, I don't want to let's look and see what the government does. But the government has already broken a number of promises. The government's policies when it comes to seniors are not meeting the need that exists. The Liberals like to talk about the changes that they've made to OAS and the fact that they've increased the GIS for seniors living alone. However, these are just little measures, Mr. Speaker. There isn't a true national policy focused on healthcare and quality of life for seniors. We don't just want government smokescreens. It's time that we have a real strategy that will be lasting and that will meet the needs of our seniors. That's what the NDP proposed this fall, and my Liberal colleagues' motion is, in my opinion, not specific enough. I'm asking for clear commitments from the Liberals in terms of how they intend to implement this national strategy. I would also like, Mr. Speaker, to raise another problem that the motion does not address. Vulnerable seniors are more often than not vulnerable women. Women at the same age as men have twice the chance of living in poverty. Too many live in poverty. A national senior strategy must include a specific strategy to fight vulnerability and poverty among senior women. In my riding, I have met many women who live under the poverty line. They're waiting for the government to show leadership and act at the national level to ensure that all seniors from coast to coast to coast have access to the support that they need to continue to live a quality life in their communities. And to conclude, Mr. Speaker, this generation forged our communities. And we also need to think about the seniors of tomorrow. Every time the Liberals take a step back, more people will suffer. The NDP have been working for a very long time to support our seniors. It's time for this government to take its responsibilities seriously and act as soon as possible. Thank you, Mr. Speaker. The Honourable Member for Sackville, Preston, Chesapeake. Thank you very much, Mr. Speaker.
Great pleasure to stand in the House tonight and speak from, of course, representing my riding, great riding of Sackville, Preston, Chesapeake, which you know very well, which is the outskirts of Halifax and Dartmouth, and a very important part of our HRM community. And it gives me great pleasure to speak about seniors. This is a topic that's extremely important to Canadians, and I want to thank my colleague from Nickel Belt for his motion. I believe this motion is a major step forward towards maybe very soon seeing a national strategy for seniors. But this is important to have the discussion, look at all the pieces, and see how we can framework this so that we can be successful as quickly as possible. Now, we need to keep in mind that demographic shift in Canada. It is a big issue, an issue that we need to talk, look at, study, analyze, and bring solutions to the table. Now, in the last, since 2011, Mr. Speaker, since 2011, we have seen a 20% increase in Canada in seniors 65 and older. Now, I guess I should explain that I'm talking mostly about 65 and over because in certain parts of the country or in the States, we talk about 55 as being a senior, but I'm focusing more on 65 and older, but also those that will soon be in that age category. Now, in Atlantic Canada, Mr. Speaker, we have the highest level of seniors per capita in the country. So whatever the challenge is in Canada, it's amplified that much more in Atlantic Canada. And now, let me add that in Nova Scotia, we have the second largest number, if you want, of seniors, just 0.1 differential from New Brunswick, so extremely high in Nova Scotia, the seniors 65 and older. But, Mr. Speaker, it is extremely important to note that in the riding, my riding, of Sackville, Preston, Chesapeake, we are the highest in the province of Nova Scotia. We have 33.9% of increase, I should say, since 2011. That's an enormous increase of seniors, and that's an example of the challenges we will get. Now, on the other side of the coin, Mr. Speaker, what's really important is to keep in mind that seniors live longer, and that is good news. That's good news for all of us. And we have seen an increase of 20% of seniors living past 85 in Canada. And we've also seen, believe it or not, a 40% increase in seniors living over 100 years old. So this is since 2011, of course. So these are big numbers, and that's why we really need to look, not at the challenge in front of us, but as my colleague has said from Nickel Belt, we need to look at this as opportunities that are available to us. And again, I want to thank him for that initiative. And I believe that these discussions can lead to something extremely positive towards a national policy. Now let's talk about seniors. Seniors are, you know, many of them today, I remember way back when that 55, they say, you know, 55 is the year of retirement, but really seniors now are working much longer, and that's extremely positive. And they're very successful because they have a lot of experience. They have the skill. So if we look at, for example, we've noticed that seniors, that's either before retirement or when they retire, they are thinking about or starting a business. But those who have started businesses and have a business going for 5 years or more, so that's where the gap between success and not so successful is determined around the 5-year point. We're seeing that seniors that start businesses are 70% successful in their business, whereas younger people are only around 30%. So seniors, we need to get seniors more involved. And how can we do that? That is the question we need to talk about. Now, our government has a role to play. It has a role to play in promoting the engagement of seniors, of creating, speaking with stakeholders about engaging seniors, which is extremely important, and I believe that we need to continue to do that. Now, there are seniors, of course, that decide to retire, and that is, of course, a great option as well, because after working a large number of years, that is an option that seniors have, and that is extremely beneficial. But the seniors, you know, we must keep in mind, Mr. Speaker, that the seniors who retire, those seniors are not staying home. They are active. They are volunteering communities. They are volunteering in different organizations. They are contributing to the community. They are key community members, supporting and working hard. But those individuals have barriers, and those are the type of conversations we need to have. We need to have a discussion around the barriers and how we can help. So some of the barriers would be the cost, of course, for them to do activities and volunteering. It's the transportation, of course, is another barrier that we have. So another barrier is knowing what opportunities are out there. So we need to promote and communicate much better so that seniors can get more involved, because we need to tap into those resources. These individuals have the skills, the knowledge, and the willingness to contribute to their community, and that's value added, and we need to take advantage of that. Monsieur le Président,
Mr. Speaker, I would also like to share with you that in a report from 2014, the Canadian Institute for Health Information indicated that 45% of the costs incurred for health care are for seniors, despite the fact that they represent just 15% of the population. So there can be no doubt that that's substantial. So that's why we need to find the means to support seniors, to limit their health care needs and to prevent chronic illness. So how can we do that? Well, there are some strategies that we can continue to share. But certainly a healthy lifestyle and an active lifestyle, that certainly helps. It's important to ensure that we have the means to support our seniors in that area.
I would also like to share that it's the rising poverty around seniors. That is a big issue. Many of my colleagues have spoken about that today, and it's one that we must ensure that we continue to speak about and try to find solution. For example, in Nova Scotia, 33% 33% of seniors over 65 living single seniors are low-income seniors. So that is a big number that we need to continue to support as well. The correlation, of course, between seniors and I would have to say, I guess, between income and good health is essential. So if their income is better and they are able to stay more active, then the health, of course, their health will be improved and they will be able to continue to contribute. And that's an important factor as well. So let me list, Mr. Speaker, some of the key things. I know I only have 2 minutes or less, but some of the key things we've done. The GIS, which is the Guaranteed Income Supplement, has allowed 900,000 seniors out of poverty. Extremely important. The OAS, the Old Age Supplement, staying at 65 years old and not 75 is $17,000 it represents. The National Housing Strategy that we put together, the Health Accord, those are all strategies to help and work, support seniors. The compassionate care of 26 weeks to 26 weeks. So, Mr. Speaker, in closing, it's extremely important to note that our government has been, since we've been elected, putting many strategies in place to support seniors. And this conversation is essential to allow us to look at the big picture and possibly in the near future having a strong national senior strategy for all Canadians. Merci beaucoup, Monsieur le Président.
Thank you, Mr. Speaker.
Mr. Speaker.
In debate, the honourable member for Yellowhead, I have to inform him, and I think he already knows perhaps that in about 4 minutes or so I'm going to have to end this debate and give a reply to the sponsor of the motion. Honourable member for Yellowhead.
Thank you, Mr. Speaker, and I'll probably read through this. I was going to do a lot of ad-libbing, but I'm going to read through a lot of it. I rise in this House today, Mr. Speaker, to speak an important motion by the member of Nickel Belt. M106 is an important motion because seniors make up growing demographics in Canada. In fact, the recent 2016 census, Mr. Speaker, showed that we are growing at an alarming rate. We're up to 16.9%. In fact, there's more seniors in Canada than there are people 15 years of age and younger. Meanwhile, the portion of working age population, those between the ages of 15 and 16, Mr. Speaker, have declined, and from 68% to 66%. Given that seniors are one of the largest and fastest growing demographics in Canada, it's paramount that we now take action to deal with the corresponding effect of aging population. This is why this motion is so important, Mr. Speaker. However, M106 highlights a lack of seriousness on behalf of the Liberal government when it comes to addressing the needs of Canadian seniors. It leaves out necessary actions that must be taken in order to appropriately address related concerns. Over the years, I have presented several petitions calling for national strategy on seniors and palliative care. Mr. Speaker, a national strategy would ensure that many of the issues important to seniors, such as establishing a national strategy for Alzheimer's disease, other dementias, improving palliative care, and ensuring quality home care are listened to and addressed. Such a strategy is addressed in Section E of M106. However, something that is not addressed by this motion is the lack of representation for seniors within the government cabinet. Our Conservative Party believes that seniors are important, and as such, they deserve their own portfolio, Mr. Speaker. We have a Minister of Children and Families, as well as a Minister of Youth. So where is the Minister for Seniors? It's clear that Canadians recognize the importance of such an appointment, but does this government? The dramatic drain of Canadians' population will reshape the economy, stifle growth, and force government to provide for a growing number of seniors with a shrinking pool of taxpayers. Currently, the government does not have a sustainable plan to address both the challenges and opportunities that stem from the unique shift in our country's population. Instead of a plan, they have plunged our country deeper into debt, along with our citizens. In fact, Budget 2017, Mr. Speaker, did very little for our seniors. Instead of introducing tax measures that would have helped make life more affordable for those living on fixed income, it scrapped tax credit that seniors rely on, credits like the Family Caregiver Tax Credit and the Public Transit Tax Credit. Yeah. Budget 2017 catch-all policies with the word seniors stamped on them are not enough to address the very well needs of our aging population. Another problematic aspect of M106, Mr. Speaker, is Section B, which seeks to restore the age of eligibility of old age security to 65. Everyone knows Canadians are living longer and healthier lives, and OAS programs need to reflect this new reality, Mr. Speaker, and provide the option for individuals to work longer and receive higher retirement benefits. In Budget 2016, the Liberal government set up an advisory council. That advisory council came back to them in 2017. It said that they needed to address this. It was important. They could see the need. M1016 is in direct contradiction to what the Advisory Senior Council stated. If the age of eligibility for OAS recedes back to 65, in 13 years, that cost is going to go up by $10.4 billion. And also, the guaranteed income supplement will go up by $1.2 billion in 13 years. Given Canada's current economic situation, it's very concerning that the Liberal Prime Minister has demonstrated that he does not take long-term financial sustainability seriously. Canadian seniors deserve a government that will stand up for their needs and deliver long-term results. Our previous Conservative government had a strong and dynamic record of support for seniors. We were transparent and vocal to end elder abuse and senior communal isolation by establishing the New Horizons for Senior grant program in 2011. Our record shows that the Conservatives made the largest increase in guaranteed income supplements in a quarter century. We created tax-free savings accounts to allow Canadians to benefit. Our previous government expanded the Compassionate Care program, provided tax breaks to caregivers. And in 2011, we reduced the number of Canadians in need of housing through a multi-level government framework and put in $1.4 billion. Close to 184,000 households, Mr. Speaker, benefited. I know I'm running out of time, Mr. Speaker, and I just want to say a couple things. But, Mr. Speaker, I'm concerned about the future of our aging population. The Liberal government continues to demonstrate a lack of respect for Canadian seniors and their concerns by refusing to appoint a Minister of Senior or commit a timeline for national senior strategy. Therefore, I urge this House to support the amendments to M106 and support meaningful action. Mr. Speaker, in closing, I had a lot more to say, and I wish I had the time to say it, but I want to say a couple of seniors play an important role in our families, our communities, and our workplace. They're the people that started this country. They're the people that still contribute one of the greatest amount of volunteer time in our communities across Canada. I'm proud to be a member of the Senior Caucus, and I'm proud to be a senior myself. I'm not turning grey like some of them, but I'm losing hair like a lot of them. But, Mr. Speaker, I want to thank all the seniors across my riding and Canada who give of their time to our communities. So this question begs me to be asked. Shouldn't Canada's fastest growing demographics have their own voice in government? Thank you, Mr. Speaker.
We almost ought to have a standing order saying you shouldn't be discussing hair around here. Honorable Député de Nickel Belt.
The Honourable Member for Nickel Belt.
Merci, Monsieur le Président.
Thank you, Mr. Speaker. First of all, I would like to thank all of my colleagues who participated in today's debate. Thank you to all the colleagues that I met and who added value to the debate, who indicated how important seniors are when it comes to the fact of our aging population and the real need to act. I would like to thank the riding of Nickel Belt and all of the organizations that I met who gave me a great deal of information and who continue to stay involved and call attention to real measures to set up a national strategy. I'd also like to thank the many volunteers and families that I met. They are in ridings throughout all of Canada, and they work to help seniors. They work on their quality of life. One comment related to what was said earlier by one of my colleagues, by one of my Conservative colleagues. When we look at what has been done, and really nothing has been done in the last 10 years. When we look at the Conservative record over the last 10 years, we've seen that they can talk that there was a minister who was responsible for seniors, but what did it produce? What did it produce?
Old age security to 67 from 65. That's their track record. There's been no increase. We as a government, we've increased for the first time the GIS by 10%. This is the first time 900,000 Canadians are benefiting from that. This is the action that we're doing. We're taking action. We're putting a housing strategy. We have palliative care. We have home care. We're taking steps to making that happen. So I will take, when we look at what, and I'm really disappointed that the Conservative government or the Conservative members feel that they don't want to support that. So it's very interesting that they're doing that. I'm just going to be adding, Mr. Speaker, Madam Speaker, when we look at our budget in 2016, we've done more in one budget than the previous government did in 10 years for seniors. So let's take that on the record. So I'm really happy to be looking at getting the seniors motion in place, and what we're looking at here, and I'll just mention one statistics when we look at the Canadian Medical Association Demand a Plan program. They're putting that in place. 55,000 Canadians are asking the government to put a senior strategy in place. I've received in the last 2 days, leading up to today's hour debate, over 1,200 emails from Canadians just to my account to say, my email to look at how can we establish a seniors strategy. So there is a need to set up a senior strategy, and the House of Commons here will have an opportunity, all members will have an opportunity to put in place a vote in the next little while to put a national senior strategy in place. So I ask all members of Parliament to look at the needs of seniors and to look at how can we put in place a strategy that will meet the needs of our aging population. So, je remercie en terminant, Monsieur le Président.
To conclude, Mr. Speaker, when it comes to the last point about the Seniors Council, that is an important tool in my motion to establish cooperation and dialogue. And so I would like to thank all of my colleagues here for having supported this, and I look forward to establishing a national seniors strategy. Thank you, Madam Speaker.
The question is as follows. Mr. Serre, seconded by Mr. Nault, move that in the opinion of the House, the government should A, recognize that seniors, namely Canadians aged 65 or older, make up a demographic that requires ongoing attention from the government as the proportion of seniors relative to the Canadian population continues to grow, 15% in 2015, 25% by 2035. Should I dispense?
Is it the pleasure of the House to adopt the motion?
On division?